So hi, yeah, my name's Paul Leeder. I'm a general and upper GI surgeon, so I specialise in any surgery related to the top of the abdomen, gastroesophageal, gallbladder surgery. But my specialist interest also is keyhole surgery. So I'm a specialist trained laparoscopic surgeon. So as well as doing the upper abdomen, I also do a lot of hernia surgery. So it's interesting. I don't come from a family of doctors. As I was going through schooling, I enjoyed sciences, and I had a particular empathy, and I think I liked looking after people. That's one thing. That's the reason I went into medical school. So I thought putting the sciences and the caring together, it seemed like a natural way forward. So surgery is interesting because when you go to medical school in the UK, you have lots of experience in all sorts of different specialties, and the two that interested me most were psychiatry and surgery, and they're like complete opposites, really. So I was conflicted for a while. But I think the thing that drove me towards surgery was that we have sort of definite finite outcomes that I think it suits a certain personality, that if you see a problem, you can actually do something. You can actually cure problems. So, if I see someone with a gallbladder hernia, I can actually cure the problem. I can resolve the issue for them with a simple procedure, such as keyhole surgery. And when they come and see me, I have significantly improved their quality of life. And to me, that is immensely satisfying. I don't think you can get that really from any other specialty in medicine. So the most rewarding bit, is I've mentioned already about helping people and the outcomes that you get with surgery, and that's very, very rewarding, but also the personal relationships you develop with people. So a lot of people come to me with symptoms related to the upper GI tract, and it may not be immediately evident as to what the problem is. So I get a lot of what we call tertiary referrals, so people from other colleagues, either in medicine or surgery, who may have struggled quite a bit with patients, and they come to me just to get a wider, what we call sort of holistic view of the symptoms they have. And I do pride myself in being able to spend quite a bit of time just searching through those problems, just working out what is important to that patient and working out the best way forward for them. Because more and more problems, there may not be a simple surgical solution, and it's looking at alternatives and how we can work, often as a multidisciplinary team, just to be able to get a good satisfactory outcome from that, for that individual's case. So it's interesting, whenever I get feedback, and we always regularly ask for feedback from patients, I'm told I have a very empathetic manner, so people do like to come and see me because I look at the bigger picture. I think I'm able just to drill down what is the most important points and the most important problems for those sort of people, and we look at that sort of that wider picture. So it's not just looking at the lump and removing the lump. It's dealing with the bigger issues. And also, the one thing about my surgical specialty, dealing with laparoscopic surgery, is that it's very technically demanding. I've gone through many years of training and specialist training to get to this position. I'm now in the privileged position to be teaching other doctors, both nationally and internationally, and I'm sort of passing on my techniques. And I know from our outcome audits, both locally and nationally, that I get very good outcomes. So I'm very proud of the results I get from my surgery. It's all down to that sort of minute detail that that we get with keyhole surgery that leads to good outcomes.